Good afternoon, and thank you for being with us today, this afternoon. Today I'm going to talk to you about patient-inclusive approach in the treatment of psoriasis, a principle without borders. So these are my conflict of interest. So the patient perspective. The patient perspective is a globally recognized as an independent dimension of healthcare quality, along with clinical effectiveness and patient safety. So the experience journey of the patient, we really know that it's really difficult. And healthcare providers who seek to understand the patient perspective of their experience will obtain a better and greater understanding of the patient experience. We all really focus on shortening this patient journey and make it more affordable and with a better quality of life. That is what I think all here is, all of us, we are here, we're really committed with that. So, as a dermatology, when I am sitting in front of a patient, I'm just thinking maybe that PASI, BSA, DLQI, I'm thinking about the patient's comorbidities. But when I am the patient, I'm only thinking that I want to get rid of this disease, that I want to get rid of these plaques, and I only need to be healthy. And that is something that we must understand as dermatologists. So, psoriasis patients really have a great impact, not only in their physical, but also in social aspects, also in emotional aspects, and in economic aspects. We really know that this is a burden in all of these aspects that I have been mentioning, and this is something that we should consider when we face a patient. So they carry with this stigma, and the cumulative impairment over a patient's lifetime really is so overwhelming for them because they have to make decisions all over their lives that have been related to their disease. Because what am I going to study, what my profession is going to be, who I'm going to be related with, everything is decisions that have been taken with the burden of the disease. And that is something that as dermatologists, we should really understand and try to empathize with our patient. So, negativity impact on patients' relationships, productivity, and careers, the increased risk for early mortality, the prevalence of comorbidities, such as psoriasis arthritis, cardiovascular disease, diabetes mellitus, and all the others that we know. And anxiety, depression, social isolations, all these are related in our patients with psoriasis. So this is a study published in 2020, Patient Perspective and Experience of Psoriasis and Psoriasis Arthritis, a systematic review and thematic synthesis of qualitative studies. These have been published in Sydney. And this was a systematic review of 56 studies, almost 1,500 adult patients with psoriasis and psoriasis arthritis. So 6 themes were identified. First, suffering and controllable and ongoing upheaval dictating life choices and course, disrupting families and social roles, limited by debilitating symptoms such as fatigues, for example. Weighed down by mental load, anxiety, struggling with distress, feeling helpless. All those themes are related to this group of patients seen in this review. Harboring shame and judgment, demoralized by inadequacies and burden of therapy. Gaining control, this is a major aspect. Gaining control is the time when, as a patient, you begin to look at the end of the tunnel, and that is really very important. And making confident treatment decisions. This is also such an important aspect that our patients have to face. So, as a conclusion in this paper, patients with psoriasis and psoriasis arthritis contend with disruption in their functioning roles and life course. On the other hand, they have enhanced therapeutic relations addressing treatment expectations and supporting psychosocial needs may improve satisfaction and outcomes, and have unmet expectations about treatment. And this is something that we always hear every day as a dermatologist treating psoriasis patients. We are always seeing that these patients come to us and say, you are the number 10 dermatologist that I am visiting, and I have never been healthy, I have never been feeling well, my plaques are the same, even all of the treatments that I have received. And this is something that we should really be focused in, trying to get these patients a better quality of life. So this is another study, quality of life and contact with healthcare systems among patients with psoriasis and psoriasis arthritis, the results from the Nordic Patient Survey of Psoriasis and Psoriasis Arthritis. This was published in 2019. So what did they found here? They did this study with 2,000 adult randomly selected patients, and they asked them if they had psoriasis. So all of them that responded that they did have psoriasis, they came to the second survey, and in the second survey, 1,264 patients reported physician-diagnosed psoriasis and psoriasis arthritis, and they were invited to the full survey. So of these patients, 1,221 responded, and 74% of them were diagnosed with psoriasis alone, and 25% of them were diagnosed with psoriasis as well as with psoriasis arthritis. So the respondent with psoriasis arthritis more frequently consulted a rheumatologist. However, 14% of them had never seen a rheumatologist. This is something that really, it was something that I would never thought about being these well-developed countries. I come from South America. I come from Chile. You know how much the difference would be with this. I mean, most of the patients don't have the access to the rheumatologist. And the respondent with psoriasis alone most frequently consulted a general practitioner. 10% of them had never seen a dermatologist. Also, I'm impressed with 10% never seen a dermatologist in these well-developed countries. So, negative impacts on the health-related questionnaire of life reported. For patients with psoriasis, and I'm going to come down because I'm not seeing, with the patients with psoriasis only, their limitations were clothing, 22% of them. Sleep disorders were reported by 16% of those patients. Depression and anxiety for 16% of the patients. 73% of the respondents with psoriasis arthritis, they also had limitations similar to psoriasis. But if you see the difference between the patients with psoriasis arthritis and with psoriasis, that you could see that almost double the patients have more limitation on their daily life. So, for psoriasis arthritis, 41% of them had limitations with the clothes, sports and leisure, 44%, daily routine, 45%, sleeping disorders, and the absence from work education was more common with psoriasis arthritis than with psoriasis, 51.9% than psoriasis alone with 15%. So, in Sweden, Denmark, and Norway, profound impact of psoriasis on the respondents of this HRQL of life questionnaire. And it was greater for patients with psoriasis arthritis than for psoriasis. Sleeping disorders and depression were really common and should not be overlooked. So just remember to always consider asking our patients, how are they feeling, how are they sleeping, and if they have any signs or symptoms of anxiety. That is really important that we look for these symptoms. So whenever we face-to-face with our patient, just try to put yourself on the patient perspective. A patient perspective is totally different from not only from patient to patient, but also from country to country and from region to region. And also it's different when you face the public system or when you face the private system, which is totally different, and the approach should be different. So just consider that. I'm going to show you some examples that we have been learning a lot. IFPA is such a great organization, more than 50 years. I'm not going to be talking too much about this because we are going to have Sylvia later telling us much about this, but I would like to say the importance of IFPA as an organization that has, through these 50 years, they have been telling us as doctors the importance of the patient and how we should be centering on the patient more than as a doctor, as we have to always try to figure out how we're going to treat the patient, what's going to be my recipe for this patient, is it going to be systemic, is it going to be topical? Just focus on the patient. And IFPA has done a great job learning us to do that. Another great project is SoProtect. SoProtect was launched during the pandemic as an international registry for healthcare providers to report outcomes of COVID in individuals with psoriasis. Drs. Habir Mahil, Professor Chris Griffiths, Professor Jonathan Barker, and Professor Catherine Smith launched this program that was not only for doctors, but was also for patients. And they had this SoProtect Me that was really great. But because what they did with this is that try to learn from the international psoriasis community how were they living with this COVID-19. So they were self-reporting their feelings, if they have been better, or if they have worsened their psoriasis, if they have stopping their medication, if they have changed their medication. We really wanted to more about them. So these are some of the results. I really invite you to visit SoProtect webpage because they also have a lot of publications about this, but this has been really patient-centered. So 43% of the patients, for example, reported that their psoriasis had worsened. 8% of the patients reported that their psoriasis was improved. And 49% of the patients referred that they remained the same. And the risk factors to worsen the disease was especially not taking the psoriasis treatment, anxiety or depression, being female, having obesity and shielding. All these were the risk factors. But as I told you, when you listen to your patients, you learn more. This is something that I'm very proud of. This is a campaign that we launched in Chile, also during the pandemic, August 2020. We really wanted to know how our patients were, not only the patients that Clínica Cruz were treating, but we did it at the national level. And what we did was a very simple webpage with medical information, but done in a very simple language so that everybody could understood. And we launched this campaign through Instagram, through Facebook, and through the webpage. So here we had, in Instagram, we had stories of patients reporting how they were feeling. So some girl, for example, posted that she had tried everything, but nothing ever gave her results. We also had many live sessions with different health authorities, policymakers, dermatologists, rheumatologists, trying to teach their patients how were they nowadays, what was the psoriasis, what was psoriasis arthritis, how should they be feeling, what are their alternatives or treatments. So through the campaign, we have now more than 13,000 followers. They're really very active in our social media. They're always sharing with the rest, like a community, how are they feeling. We learned from them that they wanted to have more information. So, because they always said, my friends think that that this is a contagious disease, or I'm not allowed to go into public pools or public. We have all heard about that. And when we listened to them, we said, okay, we're going to do this book, and we launched this book, and we give away 1,000 copies that were delivered directly to our patients. And it was something that was really great because everybody was very thankful about that. This is part of my team. We did also more than 4,000 online surveys asking our patients a lot of different questions. We have been doing publications about these studies. It has been very helpful with data that we never had in Chile before. And what we learned from this community, from this online community, we learned that the access to dermatologists was really very difficult. So we decided to do this campaign that had never been done before in my country, where we gave away 200 consultations for free for dermatology patients. And we invited them to our clinic. My clinic is a private clinic. We were really very afraid because it was only one consultation and we really didn't know how the patients were going to find this because it was only one consultation. So we decided to focus in to teach these patients how the disease was, how are the next steps to better, and for the patient to better understand the next steps that they should be taking. And the result was great. We had 100% satisfaction, and that was really great. Even if it was only one consultation, we explained the journey, and that was really something that made a difference. And we learned to listen to them, which is the most important. So for this year, we have another 200 consultations for free, focusing on early diagnosis for psoriasis arthritis to better access to the rheumatologists, which is really difficult in our country. But the most important thing of all, I would say, it was not just the patient satisfaction. It was especially the team satisfaction. It was something that really, really was amazing for all the team, and they are all very committed to this second adventure. So, thank you very much.
Thank you, Claudia, for a very timely reminder to all of us that psoriasis affects every aspect of patients' life. And this is particularly important when we have more and more data suggesting that if we treat our patient adequately, we may prevent psoriatic arthritis, which have more impact than psoriasis itself. And I also can feel her dedication in improving patients' care through all her efforts in getting patients' perspective to plan your care. So this is what we can learn from Claudia. Because we started late, so I will allow 1 or 2 questions. Do you have any question for Dr. Claudia? No question? Any comment?
Joel Gell from the United States. It was a really nice talk, Claudia. Thank you for it. Can you give us a sense of how far your patients travel to see you in these consultations, and how do they get there? Is it public transportation, or how do people manage this?
Well, that's a very interesting question because we did have patients from other regions. We have a very long and narrow country, and some people had to take the bus for 10 hours, for example. Some others also took a plane to visit us. But most of them got there by public transportation.
A 10-hour trip shows you how much people are impacted. That's about as strong an impact you can show.
Yeah, definitely. Okay.